Welcome to this introduction to Medicare and Medicare Supplements. This video is brought to you by Bill Conroy of Conroy & Associates. Since 1983, the Metro Atlanta-based firm has been helping small and medium-sized companies design and implement health insurance programs that meet the needs of employees while focusing on the budgetary constraints of the employer. They will also assist in the transition from employer-sponsored group insurance to Medicare. This video is intended to help those approaching age 65 and retirement learn more about Medicare supplements. What is Medicare? Well, let's start with the basics. For the purpose of this video, we'll assume that you'll be turning 65 in the near future, or you're over 65 and still working full-time. In either case, you're trying to get a better understanding of how Medicare works. Although covered by Medicare, I will not be talking about those people under 65 who qualify for Medicare benefits. There are 4 parts to Medicare, and Medicare is split into 2 key areas of healthcare coverage. Part A covers inpatient hospital care, and Part B covers doctor services and outpatient care at hospitals. Part C is administered by private insurance companies but is regulated by Medicare. And in January of 2005, Medicare Part D for prescriptions was introduced. We'll talk a little more about Part A and B later. What is a Medigap policy? Similar to your private insurance plans prior to age 65, Medicare will require a copay and a deductible. Medigap insurance is a policy meant to cover these deductibles as well as the copays. This slide and the next convey a little history about the Medicare program itself. It was originally signed into law by President Lyndon Johnson in 1965 after 20 years of discussion starting with Harry Truman. President Truman was the first person to enroll in Medicare. In the early 1990s, Medicare was changed to reflect a standard plan for all states. I'll talk a little more about that in a minute. The mid to late 90s saw some changes as Congress began to grapple with the growing cost of the program. From 1965 to the late 1980s, hundreds of different insurance companies were selling Medigap policies. It was extremely confusing, and after years of complaints from their constituents, the U.S. House, Senate, and the insurance commissioners from each state devised a plan that would standardize all Medicare supplements. This meant that if you purchased a Plan C from AARP in Georgia, it would offer the same plan benefits that was offered by Plan C at Blue Cross and Blue Shield. No variations. If you purchased a Plan C in North Carolina or Illinois, it is the same Plan C that you would get in California, Arizona, or Florida. No differences allowed, the same plan benefits for the same plan name. To demonstrate this standardization, the next 4 slides are the Medigap plan charts for AARP, Blue Cross Blue Shield, Royal Neighbors of America, and United World Life Insurance. Since we talked about Plan C in an earlier slide, focus on Plan C in each of these charts, and note that the coverages offered are the same. Here you see Blue Cross and Blue Shield. Make note of Plan C. Royal Neighbors, you'll see their Plan C is the same as Blue Cross and Blue Shield. And finally, United World Life Insurance Company. Did you see how the coverages offered under Plan C were identical on each chart? Prior to joining Medicare, a majority of people's health insurance plans are called 80-20 plans. After you've reached a deductible, the insurance plan covers 80% of your health care costs, and you're responsible for a 20% copay out of pocket. Since this was the model in the marketplace in 1965, Medicare was modeled after those plans. Medicare basically replaces the role of the insurance plan in the 80-20 plan model, meaning that Medicare would cover 80% of your health care costs after the deductible has been met. You can cover the 20% out of pocket, or a Medicare supplement policy can cover the 20% for you. The following slide illustrates what we're talking about here. Pre-Medicare eligibility, your health care insurance plan would pay for 80% of the health care costs after a deductible had been met. and then you'd be responsible for the 20% difference left over. Medicare eligibility means that Medicare pays 80% for you after your deductible, and you're responsible for the remaining 20%. Or you can get a Medigap policy to pay that 20% for you. Here are the 2008 premium costs for the Medicare parts. Medicare Part A, it's no cost to you as long as you've worked for 40 quarters in the U.S., but there is a $1,024 deductible annually. Medicare Part B, which covers the doctors, has a $135 annual deductible, and it's $96.40 per month to have the coverage. Medicare Part D is a prescription plan coverage. It's $35 per month to participate in the plan, and then there's a copay that applies to each prescription, and depending upon what your prescription medication is, that cost will vary. Now that we've discussed the pricing for your monthly premium as well as the annual deductible, let's talk about Medigap policies. Well, what differentiates the carriers? Medigap standardization was meant to allow the consumer an easy method to compare plans and companies. These companies will differ in their service levels and their pricing. Some of the areas where pricing might be different for individuals are smoking status, age, and gender. The next slide talks about the four companies we discussed earlier where we saw their charts. We're going to talk about AARP, Blue Cross Blue Shield, RNA, and United World Life. As you can see, this is for a 65-year-old female who's a non-tobacco user. And the pricing is different amongst companies, and you'll also notice that not every company has to offer all of the plans. Blue Cross Blue Shield does not offer Plan B nor Plan G. Here you see the 65-year-old male, and you notice that the pricing has gone up across the board, yet United World Life is still more inexpensive than the rest. Now let's try to ballpark your monthly premiums once you get Medicare eligible. Your Part A hospital premium would be $0 per month. Part B for the doctor's coverage, $96.40 per month. Part D prescription, $35. We mentioned that copays may be different based upon drug. Medicap policy of $120, and total premium of approximately $251.40. It could be as low as $212.48 for a non-smoking 65-year-old female. Well, now that you've learned about Medicare and Medicare supplements, you're probably asking yourself, what's the next step? Well, the first thing you need to do is determine the date that you plan on joining Medicare. For most people, that's going to be their 65th birthday. In some cases, people work past their 65th birthday, and in that case, it will be the date that you retire. Either way, 2 months in advance of that event, call Medicare to notify them that you're ready to enroll. You can do that by reaching them at 1-800-MEDICARE. You'll then receive a card with an effective date of your Medicare eligibility. Once you receive that card, contact Conroy & Associates to learn more about the Medicare supplement plan that's right for you. We'd like to thank Bill Conroy of Conroy & Associates. Bill's been serving his community since 1983. And if you have any questions regarding insurance policies, Medicare, Medicare supplements, please reach out for Bill or check out his website at www.conroyinsuranceservices.com. Thanks.